Great. Welcome, everybody. My name is Sonia Diaz, and I want to thank you all for joining this discussion about the role of workers amid COVID-19. The UCLA Latino Policy and Politics Initiative is very excited to provide this forum to talk about the needs and the power of workers during this global pandemic. But before we start, I want to take a moment to acknowledge the uprisings that we've seen not only across the United States, but across the world. In response to another unarmed Black man dying at the hands of law enforcement. As communities of color, and in particular the Black community, grapple with the health and economic inequities of the coronavirus, the death of George Floyd, the murder of George Floyd, highlights for many people that the color of a person's skin still determines their access to the basic right of life. Today, we're talking about essential workers who are on the front lines of the COVID-19 crisis. We want to put a spotlight on those who have kept us safe, kept us fed, and protected during this pandemic. The name essential implies a recognition of their importance in this moment. But as we'll discuss on today's panel, many workers do not feel that the economic and safety protections they've received reflect this significance. To tie it back to the much needed conversations we are having about racial injustices, many essential workers who are risking their lives for minimal pay and limited worker protections are often people of color and the working poor. As we move towards reopening the economy, data has made clear that there are higher rates of fatalities and infections for Black and Latino residents and for Pacific Islanders and Native Hawaiians. This needs to spark a conversation on how we're protecting our frontline heroes. Today's panelists are working directly to protect these workers and to tell their stories with them, to not only listen, but to amplify through policy, through facts, and through reporting. We're excited about the robust conversation we're going to have on the ignored aspect of COVID-19, which are the same people that here in California, the world's 5th largest economy, and here in the US, the world's largest economy, are struggling and purposefully left out of relief and recovery efforts. Maria Calvido will be our moderator. She is a senior fellow at the Advancement Project involved with Bold Vision 2028, an effort to build a more inclusive Los Angeles. David Huerta is the president of SEIU, United Service Workers West, which represents 45,000 janitors, security officers, airport workers, and other property service workers throughout the state of California. Diego Cartagena is the president and CEO of BetCetic, and he is the first person of color to lead the legal service agency. Alejandra Reyes Velarde is a Metro reporter with the Los Angeles Times, who has written about the effects of COVID-19 on service workers. I will now hand it over to my friend Maria to facilitate this dynamic conversation at this unprecedented time in our nation's history. And I thank you all for being here. Thanks so much.
Rookie mistake, I didn't unmute myself. So Sonia, thank you so much for introducing us and then and to acknowledge the moment that we're living through right now. Thank you for that. I wanted to start by sharing some of the data that Advancement Project California has released as part of our race counts work. It should take just a minute to run through this. It is specific to Los Angeles County, and I know that our audience is broader than that, but it does help tell a story of what the spread of COVID-19 has looked like in communities. This is data that is being updated by Advancement Project California on nearly a weekly basis. And you can see, at the very start of this pandemic, cases in white communities were much higher than in non-white communities. And they actually, at the beginning, they had rates of 2.8 times as many cases than communities with lower white number of white residents. And now, on May 27th, we see that in white communities, the number of case rates has lowered. But if we look at the Black community, the Black community started with rates back on March 27th, about 1.21 times as many cases as communities with lower number of Black residents. And that's continued to grow. You don't see the type of decline that we saw in communities with a higher number of white residents. And you just see that growth climbing. So as our elected officials and our businesses are rallying to open the economy in our communities, and here the Latino community, you can see at the very start, our communities had much lower rates of infection, and that just continues to climb. So while there may have been a flattening of a curve in non-POC communities, we really don't see that happening in Black, Indigenous, Latinx, and other communities of color. So I think it's important to just keep in mind what's actually happening in the communities. And so I just, being a bit of a novice with this, I just want to make sure that I did stop my screen share. And we'll turn to, we'd like to hear from Alejandra, actually. I know that Alejandra's been on the front lines, in contact with essential workers, and love to hear from you what you're hearing from workers that are on the front lines of this pandemic.
Yeah, of course. Hi, everybody, and thanks so much for having me. Um, I mean, essentially, when I talk to people, I get similar senses of fear, helplessness, and disappointment that despite being called essential workers, they don't feel like that importance is being shown really through the supplies that they're giving, through the resources that they're given. Um, yeah, it's really interesting how the same kind of sentiment is echoed again and again as I talk to these people. I'll give you an example actually, and I recently did a story actually on the way that the data has shifted from wider, wealthier communities having higher rates to now switching, and now we're having more diverse communities of color, lower income communities continuing to see cases. And when I've asked people about this fact, one woman actually, she's a garment worker in Koreatown, and she told me that she feels like the virus was created to eliminate the Latinos, which was a really heavy statement. But she actually believed it, and that was really sad to hear. She talked to me about how she had acquaintances or friends in Beverly Hills, just through kind of like family members working as uh, like maintenance homemakers, housemaids, sorry. And she talked about how they didn't have the same concerns. Her friends or her acquaintances, they were doing perfectly fine, or they experienced it through a screen. They experienced this crisis through a screen, whereas she sees it every single day in her community. Whereas she's seeing every day her friends are getting sick in Koreatown, her family. And so she expressed to me, her name's Inda Lopez, she expressed to me a sense that she is being targeted, that her community is being targeted, even though, of course, this is an invisible, I guess, enemy that doesn't discriminate based on race. But it does definitely show itself differently in different demographics. Yeah, I've one of the stories that I've really connected with was a college student. Her name is Diana, and her parents are undocumented essential workers. And she talked to me about how she kind of watched her parents go to work without the equipment they needed, helpless, feeling like she couldn't help, she couldn't do anything. They didn't get tested until weeks after they started showing symptoms. And that was simply because they didn't know, they didn't have the access to the information. And because of that, her father ended up being hospitalized, and she really had that moment where she didn't think she was going to have her father anymore. Thankfully, he's okay, as far as I know. But these are the types of stories I'm hearing again and again. There's an overwhelming sense that even though things kind of are slowly, the resources are starting to come, and everybody for the most part has the basics of maybe like a mask and gloves, for example, there's that sense that it's not enough. And I'm continuing to hear that even now, even as the economy is reopening.
David,
Oh,
I imagine that, sorry.
sorry, you were on mute. Go ahead.
Okay. Well, Alejandra, I mean, I'm curious what David had, what of the stories that you just shared a spark for David in terms of the story of Diana and her parents leaving and not having the kind of equipment that they need. Diego, this must resonate a lot for the workers that you represent.
Yeah, Maria, and thank you to the UCLA UCLA Latino Policy Institute for making this happen today. I think it's such an important discussion at this moment in time. SEIU SWW, we represent 48,000 members throughout the state of California. At the very onset from this pandemic, we lost almost overnight 13,000 members who were immediately pretty much lost their jobs. You know, thank goodness they have a union, and we've been able to, through the different resources we have through our trust funds and whatnot, to be able to maintain with people with healthcare. We've been doing webinars with workers to be able to get them to navigate, unemployment benefits. But not all of our members have been so fortunate or so privileged to be able to be those workers who can collect unemployment benefits because of their status. And, it's been a struggle every day to ensure that workers continue to be able to have safety. And when I say safety, I mean personal safety, because a lot of times we think we conflate the idea of workplace safety with personal safety. The reality is that they're two separate things, and workers need to feel safety in the workplace, to be secure, especially in this moment in time, and then to ensure that there's conditions in the workplace that to the best of its ability, create workplace safety. That has been, since day one, both a mission for the organization to ensure that, but also to how do we also advocate for the 13,000 workers who multiply that by how many more thousands, 40,000 as of right now across the country, who are without work. And many of those workers depend on their jobs for their health care. They depend on their jobs to be able to secure security in their lives. But when we look at the makeup of our organization is we have three of our four divisions within our organizations are considered essential workers. And as janitors, as security officers, as passenger service workers in airports. And each one of those classifications carry its own level of risk. They have risk in them. And to Alejandra's point, our workers every day when they open that door and walk out and take that bus, because many of them are dependent on public transportation, take that bus to work. They not only take the risk at work, but going to and from work, because they are exposing themselves to folks that they are not sure, or circumstances that puts them at risk. And so our work has been again to how do we continue to advocate for workers in a moment in time of shelter in place. At a moment in time when our traditional methods of brick and mortar type of approaches to disruption and to messaging, to picketing, are not things that we can rely on. And it has been a struggle. The good thing is that, SEIU does have a very powerful position in the country. We're 700,000 workers throughout the state who are home care workers too, have been devastated by this, who are also predominantly people of color. And now to compound that with the current, circumstances with the death of George Floyd, and what that means to security officers who are predominantly African Americans, trying to also have their voices heard. So it's been a constant struggle, and one of the things that struck me about Alejandra's point is this term essential. Our members at the very beginning saw this term and were a bit perplexed by it, wanting to understand what that came with. What was the guarantees for me as an essential worker to be able to work in personal safety, workplace safety, and to have the recognition that they have never had in their past. And it's sad to say, many of them feel that this term is more window dressing than it is an actual term that comes with any substance. And so we are working on constantly trying to, and right now, especially in this moment of reopening the economy, that a building right now that's serviced by a janitor and secured by a security officer that right now is operating with only about 10% of its capacity, that soon will go to 15, to go to 20, and go to 25, and go to 30, and go to 35, and go to 50, and go to 60, and go to 70. While this pandemic is still continuing to rage in our communities, that the term essential will mean something. Because the greatest fear that I have is that, that workers who have been carrying the water for America's economy as essential workers are going to be disposable as soon as the economy opens, because those are the ones who do not have the privilege to be able to determine how they will work or where they will work from. And that is right now my greatest fear. We have seen members who have had family members die as a result of the contraction of the COVID-19. We have had members who have died as a result of COVID-19. We have members who are testing positive. And we think that number is going to exacerbate as the economy reopens, because again, our members do not have the privilege that others have. And so that's where we are right now looking to, and we are right now looking to see how is it that we take our brick and mortar type of tactics that we have relied on for so long in order to raise the standard and service workers throughout this country. I'm proud of the fact that our janitors in downtown Los Angeles are making close to $18 an hour, have healthcare, have vacation, have sick pay, have holidays, have representation on the job. But that all means nothing in the moment when they contract the virus that could kill them. And so this is right now our challenge, is how do we continue to move forward, advocating for those who who do not have the voice to advocate for themselves, and depend on organizations such as ourselves to be able to voice for them and give them the voice that they need in order to be able to make themselves heard.
Thank you, David. And your workers, the workers you represent are so, to have you in their corner, so important at this time. We know that there are a lot of folks that aren't represented by a union and are at great risk at this time. And I think those are some of the people that are going to BetSEDEC right now. I was reflecting, and personally, I've been through a few economic downturns, and I know that there's some folks that absolutely never get to recover. A lot of communities never get to recover. And I'm curious, Diego, what is the experience right now of the people that are going to BetSEDEC for assistance?
Thank you, Maria, and thank you to the Institute for the invitation to be part of this incredible panel. It's an important moment to call attention to this, and so much of what David just mentioned really resonates with our experience at our agency. What we have seen, so our agency provides free legal services to individuals in the community regardless of their immigration status, and we have an employment rights project that for decades now has focused on the issue of wage and hour violations here in Los Angeles County. And many people do not realize that Los Angeles is the wage theft capital of the United States. Millions every single week being taken out of the pockets of hardworking individuals, people of color primarily. And so what we saw under COVID-19 was our workers' rights clinic would typically see about 20 workers a month. And within about 5 days of our office turning into a remote workplace environment and turning our clinic into a virtual clinic, we saw a 1,100% increase in the number of individuals calling our agency asking for assistance. We went from 20 a month to about 60 a week. And about 90% of the individuals our clinic serves are undocumented workers. And the issues that they were facing really expanded to not only include concerns over wage and hour violations, but concerns over workplace safety. It's already been mentioned. Alejandra talked about the story of the garment worker. We see that over and over in our clinic. People reporting that there are no hand washing stations. People reporting that there's no social distancing, despite everything we see every couple seconds to stay 6 feet apart. There is no social distancing between people's workstations. This is in industries where they are themselves making the PPE equipment that everybody says is so essential, right? All of these violations. We're seeing similar issues in warehouses where warehouse workers are not seeing any hand washing stations. There is no control over social distancing. And there's really a lack of monitoring by many of the federal agencies like and state agencies like Cal OSHA because of their limited size and limited capacity. They can't be everywhere at the same time, making sure that these appropriate practices are being deployed. And so workers are very much at risk. The other thing that we are seeing in the workplace is a lot of questions over the right to paid sick leave and paid family time. It was already confusing enough for people to understand what their rights are, and then you add the confusion on top of that related to the CARES Act and the other federal laws that came before it that attempted to expand sick leave and family leave if you were caring for someone who is showing symptoms of COVID-19. And not everyone was aware of what time off they could take while still preserving their job, their employment. And of course, the other significant issue that was already brought up was access to unemployment insurance. The fact that undocumented workers, we do not have access to that. And so in addition to our direct services work, we helped form a coalition of over 100 agencies that called upon the state of California to set up a disaster relief assistance for immigrants fund that would serve as an alternative to unemployment insurance. And I'm happy to report that there were some funds put into that, some monies put into that fund, but certainly not enough. $500 disbursements to undocumented families is nowhere near the amount of funds that other workers are receiving when you consider state and federal resources. And it's really putting people at risk, and it's putting our general economy at risk. When you see there's a study out of UC Merced, I think, that showed that there is a huge flight of non-citizen, non-documented workers out of California, and there is a real concern that part of it is that there isn't this social safety net. And without that safety net in place, the impact to the economy overall will continue to be dramatic and continue to be negative. So we are proud to work with David's colleagues and the rest of our colleagues up and down the state to try and make an impact on this situation.
Thank you, Diego. Alejandra, you got to hear from Diego and David a little bit. I'm curious what this is bringing forward for you. I know that you've had many conversations with essential workers, and how has what they've shared resonated with you?
Yeah, I'm thinking about kind of when this all began, I guess in early mid-March. I started working on this reporting on obituaries actually. It was before we knew a lot of this data, before we knew for sure that Latino and Black individuals are dying at higher rates and there are more cases in poorer communities. But I started hearing stories from Latinos and I started hearing similar, like the same trends over and over: large families in small spaces, low income, who couldn't work from home. And I just started to think about that, to worry, to anticipate some of these things that we maybe already felt, but didn't know for sure, at least for me. So as I'm hearing these things from both of you, from David and Diego, it's and from the reporting we've been doing, it's all been kind of validating as well to my experience, to I'm sure for many people, their families' experiences. Um, I feel like with underrepresented groups, there can be a sense of maybe um, like, oh, maybe it's just in my head, or maybe it's not a real thing, or maybe I just need to go to work and put my head down and just keep going. But to hear these things and to hear them validated and that they're happening, I think is super important. So yeah, yeah, and I've talked to a lot of similar workers to what David and Diego described. I've talked to people in meat processing plants. I've talked to the garment workers. I've talked to the food service workers, from just all areas of work. And like I said, the same feelings keep coming up again and again, even though their needs might differ slightly, or their issues might vary slightly. Their understanding of their rights vary depending on their, a lot of the times it depends on if they have kids who can explain things to them, or if they know of resources like the ones that Diego offers and things like that. So yeah, it's great even for me to hear what they have to say.
Maria, if I could just interject and encourage all of the hundreds of people that have joined us for this powerful conversation at a time when our city and our state and our nation are on the streets. Please type in the chat box any questions you may have for Diego, for David, for Alejandra, and for Maria, and we'll get to them. We want this to be as engaging as possible.
Alejandra, one of the things I'm curious about is, one of the things that I saw and I was so moved by was the activation of all of these mutual aid networks. And I know that you've all been, I'm sure, BetCEDIC and SEIU, you've been part of them. And I'm just curious, Alejandra, thinking about the role of that government should be paying at this time. What are essential workers, when you speak to them, what are they saying about the government's response? I mean, do they feel like the government is doing its job right now, or how are they feeling? I'm curious. And I would then ask Diego and David to respond too, like what else could our policymakers be doing to meet the needs of essential workers?
Well, I think frankly, a lot of the workers that I've talked to don't even consider that level. I think a lot of the times they're looking at their employer, or even just their home, their situation, what they could do. Sometimes it's as desperate as, I can't even get gloves to go to work. I can't get a mask. Some of you have described, people are making their own masks at home. So just from what I've heard, the situation is just like, what can I do to get my employer to hear me? And I haven't heard as much sentiments of what can the government do for me? I feel like there's sometimes a sense of, the government is not here to serve me. So what can I do to figure it out for myself? I'm sure that's not the case for everybody, but that's, at least from my reporting, what I've heard. It's very kind of low-level, simple needs that aren't being met. Some of the workers have described to me at Farmer John, for instance, where there was that massive
Yes.
outbreak recently. Some of the workers are upset at the employer for not installing protections soon enough, for doing it in a reactionary way, for doing it when the first outbreak, kind of erupted, or when the media started reporting on it. And one of them mentioned to me, even when they started placing these protections, like, for example, they put plastic barriers between them to try to separate them, and they gave them face shields. That kind of sounds all good and looks good to maybe an outsider, but they were like, we can't, this is uncomfortable. They didn't ask us what we needed. They didn't ask us they don't see how we work and take into account the type of work that we do. So they were really wanting communication. They were really wanting to be a part of like a committee to come to these decisions together, so that they could feel safe and protected, but in a way that's productive. That's kind of what I'm hearing.
Thank you. Diego, David, could you share a little bit and your reactions to what Alejandra just shared?
Sure. Well, I think the first thing government can do is pass the HEROES Act, right? That just passed out of the Congress, right? Or passed out of the House 3 weeks ago, that Mitch McConnell has said over and over again that he's not going to move. The HEROES Act comes with hazard pay for all essential workers. It comes with fixing the loophole, or not the loophole, but the exclusion of immigrant workers, and ensuring that they and their families will be entitled to recovery funds. It comes with many things that are critical to what workers need at this moment in time from its federal government. And you think about the CARES Act had $500 billion worth of money for corporate America. And now we're asking, saying that you need to make sure that people have certainty beyond July 31st that they're going to continue if they remain unemployed, because the economy is not going to just restart automatically overnight, that these workers will have continued resources to be able to provide for their families and their livelihood. What we see on the streets of Los Angeles and throughout cities throughout the country is a visceral reaction to the use of force by police officers historically to perpetuate white supremacy in this country. And it's also in addition to knowing that we have lost over 100,000 lives in this country, and that this country has no solution or no strategy or no thinking about how we're going to keep people safe, let alone reopen an economy at the expense of working people. And compound that with the historic, over the last three years of putting children in cages, of speaking in a way that is derogatory towards communities of color. You can start there by just changing the tone and passing what's right now pending in the federal government. What we can do on a local level, like the state of California that has the 5th largest economy in the world, and it's going to remain the 5th largest economy in the world, can ensure that as we reopen this economy, that we ensure that we do it from the perspective of working people. That it is not just about the bottom line that needs to be delivered in a transaction, that workers are considered disposable. That when we went through the Great Recession in 2008 through 2012, our janitors went from an average production rate of 3,500 to 3,800 square feet an hour, which, and I hope I'm not going in too much into the granular here, but the equivalent of 3,500 square feet is about the average of cleaning two medium-sized single-family households per hour. That number, and granted, now there's a fine professionalism to the way janitors clean. It's not just going out there and throwing trash and it's done. It's much more than that. And they went from a 5-day specification and 5-day vacuuming, 5-day dusting, to, in some cases, where right now buildings are being cleaned simply on the visual evaluation of the janitor. Is it dirty? If it's not dirty, let's move on to the next space, because we have to clean what's dirty. Don't clean what needs to be cleaned. And when I say that is because now workers are working at 4,800 to 5,700 square feet an hour, which is now the equivalent of 4 single-family homes in an hour. And they're cleaning they're only dusting 3 days a week and vacuuming 2 days a week. With the pandemic that we all know can transfer on hard surfaces from one person to the next. Now you tell me, when they reopen those buildings and those workers are in the middle of asymptomatic workers, what is the risk that we're going to ask those workers to take, and even the tenants that come into those buildings, without correcting the austerity of the economy of the Great Recession?
Yeah.
That is the moment we're in. And that's what I would say to local government, to the state government, federal government, is that workers, essential workers, are not just delivering a transaction or not just delivering a deliverable or cleaning. They are now public healthcare workers. They are public healthcare advocates, and they have to be approached from that perspective. My janitors are my workers, my members are no longer just cleaners. They are public health advocates. They are environmental workers and should be treated as that and given the proper amount of production or proper amount of work that they can do that will keep the public safe from a virus that can be transmitted from surface to surface.
Yeah, David, that's a really great thinking of a more expansive view of what it means to have a public health infrastructure in the United States, not something that's so closely tied to a clinical medical perspective. Diego, I want to give you an opportunity to respond as well.
David has really hit it on the head there. I mean, the complexity of these issues is such that we have to be very careful. Alejandra's comments of the desire of workers to be part of the process, right? Not just to be told, well, this is what we are going to do, this is how you have to work, or the environment in which you have to work, but who better to help us understand what is necessary in order to create a safe environment and elevate the nature of the work, protect the workers, and protect our community. I think a couple things that I would add is, when we look at these issues, we see it expanding to the other legal issues that impact these families and these workers, right? Because if you are not being paid the appropriate wages, if you don't feel like it is safe to go back to work, then that is where we see our clients that come to us through our Employment Rights Project very shortly thereafter end up in our Homelessness Prevention Project because they don't have the capacity to pay the rent. Right. And then we see them in our Public Benefits Project, where they are coming to us asking questions about what public benefits can they secure? Is it going to impact, if they're undocumented, is it going to impact their being designated as a public charge down the road, things like that. The other aspect that I'd like to point out is that we think it's very, very important for local government to work with small business owners. We have seen so many of the workers that originally came through our clinics come back to us because they are passionate, they are driven by that entrepreneurial spirit. They see an opportunity for growth for themselves, their families, and their communities, and they come to us to start small businesses and wanting to make sure, in collaboration with local government, that they are propped up as mindful, supportive employers themselves, right? That they are, number one, not hindered in their efforts by all of the different laws and the confusion around how do you set up a small business, but instead come out the other end being a very responsible, positive employer in their community.
Maria, if I could interject, I mean,
Sure.
some of the things that have struck me during this time, to echo what everybody has said, but the disposable nature of Black lives, brown workers, that has only come to the face this week in many instances for many communities and many leaders. And we're at a time right now where two things are clear. One, we're in a global pandemic whereby if anybody is unhealthy, including if they're asymptomatic, they can spread this virus and it is not contained, and we don't have testing or tracing at the level necessary. So at this time when people are losing their jobs, this reliance and dependence on employer-based health insurance is really leaving us in a place where we are exposed, even those of us with insurance. And that means that it's state hospitals and federally qualified healthcare centers that are bearing the brunt of this type of provision. In fact, I have a policy fellow, Brianna Ruiz, who lives in the Imperial Valley. The two hospitals there are closed. Why? The doctors are sick, and you have to drive 2 hours to San Diego. The second thing is relief and recovery. I think audacious leadership is trying to do something to get us to a place of genuine opportunity instead of creating a system where we can have a dozen more billionaires, which to me is not a meaningful indicator of success for anybody. And what I mean by that is that if we have immigrant families that are working, which we do in California and in many parts of this country, including places like Nebraska and the meatpacking industries, that they should be entitled to relief and recovery where available. And this includes state level earned income tax credits. This includes benefits for food. This includes not being deemed ineligible because they are a part of a mixed status household. These are things where leaders can act now. And in fact, unfortunately, we've seen even in the state, the desire not to act, the desire to cut from those places at a time when we need them most.
And would any of you like to react to what Sonia just shared?
Yeah, I'd like to add a little bit more. I think, it's in particular looking at the disposability of workers, right? Diego brought up the issue of wage theft early on, and many know the history of justice for janitors and the fact that what is the janitorial industry has historically been part of the underground economy. It's been about the ability to be able to raise the standards for workers was meaning taking on an economy where employers were allowed to exploit workers and skirt the law and steal from them as a means to be able to undermine legitimate businesses. We took those issues on, such as wage theft with SB 588. We've taken on the issue in our industry because we knew we had to take on the conditions of the industry, not just trying to take on the ownership itself, and create liabilities where where owners are no longer insulated from their practices of their contractors they hire in order to be able to create their wealth. And we took on the issue of sexual assault, that immigrant women are are disproportionately impacted by the issue of sexual assault because of their status, because they work at night and they're supervised by men. And we've been driving this agenda of taking on an industry and not just looking at the transaction of a contract. And it's gotten us to where we're at now. But we are in a moment where, in all honesty, there is this sense of disposable worker, that the worker seems to be that they're exponential, that they are somewhat, and I hate to use the term, can be considered roadkill in the sense of the pursuit to make Joe Bezos the most wealthiest man in the world, so he could be the first trillionaire, right? That is what we're doing, because the Amazon worker who works in his where their distribution centers have been disproportionately catching COVID-19. And so, this sense that workers continue to have to be able to fight against the elements of capitalism that creates this sense of disposable, of considering that they're exponential, that there's these different ways that they have been able to undermine workers. And all that is a direct result of the workers' inability to be able to become part of unions, because they've made it that much harder.
Yeah.
So, we have to, I will say, in my 20, God, I'm dating myself, but I've been, working with SEIU, USW since 1996. And in those 24 years, I have never in my life have seen the demand that workers are looking towards labor in this moment in time, and the value members feel towards their labor unions, because of the fact that without them, they know they would be the roadkill that many workers right now are experiencing.
Right. Well, I want to. Oh.
So I just wanted to finish to say that, and to add that this sense of the undocumented worker right now, we've had a lot of members who have made wrong choices to go to work, knowing that they may be carrying symptoms, but they do that because for fear that they're going to lose their jobs.
Absolutely, yeah.
And knowing that there is no security net for them, that there's nothing for them. And I just don't understand. There is no solution for any of us if there's not a solution for all of us.
Absolutely.
And that includes the 10 million undocumented workers, their extended families that were left out of the CARES Act. That would, if you multiply that by 3, that's 30 million people who right now are sitting outside of any type of economic solution, let alone a medical solution to them and their families.
Thank you, David. I think this leads to one of the questions that's coming from the audience that, and it made me think of something that Alejandra shared when she talked about the outbreak at the Farmer John plant, right? That if they had just talked to workers, that the workers could have designed a solution for social distancing that would have worked better and protected them better. And so oftentimes policies are not centered on the life experiences of people. And so I'm going to field this question to Diego. Right now, Latinos represent just 18% of the California Governor's Task Force on Business and Jobs Recovery. And so what implications do you see for that when we're not at that table?
Yeah, so I think it's pretty clear then that if there isn't adequate representation, these perspectives are not going to be brought to the table. They are going to be missed, and the intersectionality here is very, very critical, right? Because we have, as has already been talked about, we have so many different workers facing so many different situations. Warehouse workers, and restaurant workers are facing different situations, and we have to take these, as difficult as it may be, we have to take nuanced views of this. You know, I am reminded of when all of this started, hearing from some workers who were childcare providers, right? And them overhearing their employers saying things like, well, why can't she, because right, it's usually women of color, why can't she just come live here? Why does she have to go back to her family, right? It would be better for us if they lived here with us. Right? And completely oblivious to the impact. And to David's earlier point, people feeling like, well, I got to continue to work in X, Y, and Z fashion under these conditions, otherwise I will lose my job, right? And so then I can't provide for my family. I think it was in the LA Times, in fact, that they had a great article about a healthcare worker who felt like she had to go in and you know, didn't have the PPE equipment, and the rest of her family got sick. And so we have to have those voices heard. We have to have those committees and representation at those committees to be able to understand at the ground level what is happening, so we can make adequate plans, adequate responses to the situation.
Absolutely. Thank you, Diego. Alejandra, thinking a little bit about the conversation that we're having right now, and kind of thinking about the future, like what stories are you going to be looking at to cover? You know, right now you've had the benefit of Diego, what he's seeing at Betzetic, what David is seeing, kind of their perspectives on the importance of being at the table, centering the experience of workers, broadening the safety net, right? I mean, we don't really have much of a safety net, right? It's incredibly frayed, and it's been chipped away at. So what kind of stories are you going to be looking for, Alejandra?
Yeah, I mean, as the economy continues to reopen, and also as people just kind of get more relaxed, just in everyday life, we're seeing it now, obviously, with the protests happening, but just also in stores. As soon as, you know, the county made the announcement that they were beginning to reopen, I think people let their guard down a little bit, and we're not thinking about the essential workers who are still there, who are still being continuously exposed. So I mean, I'd be curious to continue paying attention to that, how the impact of kind of people loosening their guard, and more crowds in the stores, how that'll compound the issue for essential workers. Also knowing that so many of the essential workers are already kind of at the brink, you know, of losing everything. Like these people are behind on rent several months. They're fearing being evicted. So one less paycheck, you know, and they're on the street. So I'm definitely I'm definitely going to be watching out for how people are getting back on their feet or not getting back on their feet. I'm sure there will be people who are on the streets after this who might not be able to recover despite the economy reopening now.
Maria, can I interject? I think it's also important for agencies like Betzetic to be listening as well, and listening to folks like David and his colleagues and his workers, right? We need to take a community-based lawyering approach. Too often, I think lawyers, and I think this is what is happening sometimes at the state and federal level, people think they know the answers, right? To go back to some of my previous comments, a lot of people think they know the answers, but we have to listen, and we have to work collaboratively and strategically to make our way out of this. So we look forward to continuing to hear from our clients, our community, and working in partnership with others. And hopefully philanthropy is listening as well, because we need as much help as possible. We need creative minds from different sectors to try and resolve these issues.
Right. And I think, thank you, Diego, for raising the issue of philanthropy, right? I mean, um, we need lots of solutions. And we need resources coming into these communities. And one of the challenges working with government is that their funds tend to not be very nimble, and they're cumbersome. And so we do need to look at philanthropy to create the flexible dollars, those bridge dollars that help bridge that time between the immediate need and the time that government can figure out how it'll issue contracts, right? So thank you, Diego, for raising those issues related to philanthropy. I wanted to go to another question that came from the audience. And one is just like, what is the role of, OSHA? That, there's a report, this question cites there being over 5,000 complaints around COVID-19 worker safety rule violations, and there not being much of an enforcement mechanism. And I don't know if anyone on the panel can speak to that in terms of, we do have state agencies responsible for protecting workers, and where are they in this?
Well, I'd like to take a crack at it. I mean, I think, it's look, I think what you see right now, as state agencies concerned, is, agencies that only meet a small demand of the violations that are out there. They're not designed to actually, with all of its resources, to be able to really create or set the tone or the consequences or the enforcement of standards. And it's more looking towards the egregious rather than the continued monitoring of. And in a moment like this where we have a pandemic, if they were not resourced before the pandemic, they're surely not resourced now during the pandemic to be able to keep up with the moment we are in. The concern I have is that, right now, I think the last number I had heard was that the state of California is now $58 billion in debt and counting, where before the pandemic even started, there was a $20 billion surplus. That's been already spent. And again, going back to the HEROES Act, unless the HEROES Act is passed, there's no replenishing of state coffers to be able to keep up with the current, with the crisis that we have right now in this pandemic. And so, my biggest concern is that we return back to a moment of austerity, both austerity in the sense of state government, city government, county government, and not only austerity, but then that austerity is driven through the economy that we have, right? And so it's again, the Cal OSHA was not designed to be able to, at this moment, in the way it's been designed at this moment, to be able to address a pandemic of this nature, nor was it even sufficiently adequately funded in order to be able to address an economy that didn't have a crisis in it. I think I don't know how you fix that in the immediate moment. I'm just being very honest. But these are the things, again, that if workers had a better voice, if workers had a stronger voice, if workers actually had the role of implementation and recommendation and being able to use their expertise of what they do to be able to then use that as a means to be able to create standards in our industries and standards in the workplace, there would be a less of a circle. There would be, Cal OSHA would be able to serve a much better role in that equation than the equation it's currently, because right now it's completely left up to the employer to determine safety, to determine personal safety for workers in a moment that those norms are no longer adequate to be able to address the crisis we're in.
Yeah, so it sounds like not only have we shortchanged workers at the workplace and their wages, but we've shortchanged the system that is designed to protect them as well. Diego, did you have something you wanted to add to that?
No, my understanding is exactly the same, is that they are so under-resourced that they really are aware of and tackling only the most egregious violations.
Yeah. You know, this question that I'm going to ask now is coming from the audience, and it takes me back to Alejandra's opening remarks when she shared the story of the garment worker feeling like this was actually a plan to extinguish her, right? That this was a way of eliminating people that were not valued. So really thinking about mental health, right? It's like, this is a moment where those of us that have, you know, the privilege of still being employed, I mean, our employer-sponsored health insurance has probably sent us emails saying, hey, you can access counseling for free. Look, you can do telemedicine. So what privilege? And the workers don't have that kind of access. So where can essential workers go to access mental health support, and if at all? So if you guys, that was something the audience was interested in hearing about. Diego, do you have some thoughts? I know that you have a whole suite of services that you provide to the community, and you must be at least referring people to resources.
Yeah. So certainly, while we're not a provider of mental health services, individuals can contact us, and we can refer them to free mental health providers in the community. Case management services. I know this is just a drop in the bucket, but I know, for example, that individuals with zip codes in LA County can sign up for free programs like Headspace. If they have access to a phone or a computer, it's an app. But really, aside from that, it's just the free mental health clinics that are available. It does bring to light other issues, or the importance of what we were talking about before, the budget, for example. It's not directly related to mental health, but there's another program called In-Home Supportive Services. This is a program that pays individuals, caregivers, to be able to provide care for incapacitated loved ones in their own home, rather than having to have them institutionalized, for example, or hospitalized. And we've seen what is happening to people in nursing homes, and yet what's the program is on the chopping block, right? And so what will happen is more people will end up being in these nursing homes rather than being cared for at home by a loved one, which, by the way, provides that loved one with, it's not a whole lot, but some level of income, right? And so again, that complex safety net has to be maintained.
I want to follow up on that on two respects, right? One of the things that David mentioned was the budget deficit that, at some estimates out of the governor's office, is around $50 billion. The legislative analyst office in California says it's about 20 billion less than that. Irrespective, we are spending money. We're spending money on masks, emergency response, and whatever priorities were recently announced in May. Now, there needs to be some sort of accountability around equity, that this money actually comes to vulnerable communities, for which data and facts can be very informative, especially as it relates to race. The second thing around this question of mental health and then providers generally, we don't have enough doctors, and we did not have enough doctors before coronavirus. This was especially true of California, and especially true of doctors that were providing primary care to medically and linguistically underserved communities. Now, the difference between behavioral care and, you know, your general kind of primary care physician is mental health is through language. And if you do not have doctors, psychiatrists, counselors, etc., that can speak Spanish, Tagalog, Vietnamese, then those communities, which are the two fastest growing communities, not only in California, but in this country, are effectively left without means. Yet we're seeing now those of us in places that are well served being referred to telehealth. So in this question of budget and priorities, it's not enough to put the fire out right now, but to create the growth necessary so that people have access to services. And so if we're going to allocate money to telehealth, we need to make sure that that lasts, so that people in the Imperial Valley don't have to drive 2 hours to a hospital. And I think that's the type of leadership and thinking that needs to happen. It's really factoring in sustainability, but it's also thinking through demographics. And I think, frankly, there is money that is being allocated, and it's simply not being allocated to the communities and workers that are key to recovery.
Yeah, I'd like to add something to that too, and you're so right, Sandra, that, one of the things that, and unfortunately, the COVID kind of disrupted it, but also amplified it. One of the things I mentioned earlier is that the organization really engaged in the question of sexual assault in our industry. It's something that we had ignored for a long time, and ignored because we felt we didn't have the ability to insert ourselves into that question. So caught up in the civil litigation versus how do we intercede in it. In 2016, we took on the effort directly through our Ya Basta campaign to talk about the issue of sexual assault of immigrant women in the workplace who are disproportionately vulnerable to the issue of sexual assault because of their status, working at night in isolation and managed by men. And one of the concepts we came out with was a peer-to-peer relationship, a peer-to-peer training of our members to become trauma informed, to be able to work and identify trauma and be able to help people get the resources they need in their trauma around the issue of sexual assault. So we also have to think about where's the innovation for us to be able to not just depend on agency, but also to create the innovations that workers have solutions themselves. And I'm so proud of the work that our promotoras have done to be able to, one, identify themselves as survivors and come to grips with that trauma, and then being able to lead through that trauma and being informed as survivors to be able to help others address that trauma of sexual assault and deal with that. Because one of the things that came out of, we transitioned in our technology right at the very beginning of this pandemic, which was really just a coincidence, but it helped us capture every type of phone call that was coming into our organization. And at the very beginning of this pandemic, we had a disproportionate number of people calling about domestic violence, calling about assault, but I don't know if those calls would have come in otherwise had we not taken on the issue with our members to not be stigmatized by an issue that we have been so unwilling to address. And I just think that things like those opportunities, those innovations of how we deal with trauma, how we deal with mental health, has to be in a way that also puts power in the hands of innovative ways of approaching it. In this case, we try to approach it through our members as a means to address it.
All right, great, thank you. Sorry, I was scrolling through, thank you, David. I was looking through the many questions that we've been asked. I just wanna remind the audience that there've been a number of resources posted to the chat box in terms of access to mental health services, the latest reports coming out. There's a question around, and I think this is really relevant for today, and it kind of takes us a little bit off in terms of, I think people are wondering what the connection is between our conversation today about essential workers. Oh wait, before I transition to this question, I just want to say, Sonia, we're spending money anyway, and I'm really glad that you raised that, because right now the city of LA is deliberating on its budget, where over 50% of its resources are invested in police, in what we've seen now really in terms of the state-sponsored violence against protesters. So we are spending money, and we are making choices about how that money is spent. And so I think it was really, that resonated for me. And I think that it's on us to make sure that budgets are a reflection of our values, and the values that value essential workers for what they are. So with that, now, actually, this does transition. This is like, what is the connection between what is going on right now and what's happening in the streets all over the country? And I'm trying to find the exact wording of the audience question. But I'm new to this software, so I struggle a little bit. But yeah, but basically the question is like, what is the connection of police reform from the African American perspective and our conversation today? That's the exact language.
Yeah, I think it's integral. It's two things. One, budget. The idea that we're spending money that is in many ways unregulated and run amok to state-sanctioned violence when we're not investing in Black families, Black wealth, Black housing, Black economic opportunity, Black health. And we're seeing that at the lack of health providers, the lack of COVID testing, the complete disparities as it relates to Los Angeles in particular in terms of the neighborhoods that are being disproportionately affected by this. We see, you know, the infection and death rates in South Los Angeles, for instance, are much higher. And in the trends in the graph that you shared earlier, Maria, we saw that, you know, white, non-white was close, big. That's because affluence had access to testing. What's happening on the streets is misguided budget priorities and a rebellion and uprising against that, while also recognizing the storied history that we have not moved forward in terms of progress and race neutrality, including 10 years ago, this idea and myth of a post-racial society has not created the support or the wealth necessary to have vibrant communities that can safely deal with the pandemic like the coronavirus. Look, people in Pico Union and Mid-City and South Central can't shelter in place. Why? Too much population density, no green space, and no markets. And I'll just, you know, go off topic to think through what happened in my adopted neighborhood here at Fairfax and Melrose. I'm born and raised in El Sereno in the east side. Everything was rebuilding and clean and swept up come Sunday morning. Now, having been here during the 92 riots and doing the research that we do at UCLA and recognizing that these communities still don't have access to essential services during a coronavirus pandemic, and like David said, have to go take transit, have to go to work, have to save our economy. That is what is so clear here, is the vulnerability, the discrimination, and the racial state violence that is occurring. And I think ultimately for me, and love to hear what you have to say too, Alejandra, in talking to all these people, there's a leadership vacuum, both because we are not getting the support necessary from the federal government, whether it's US Congress or the president, but we're also not seeing the leadership necessary that is bold and righteous during this time. And it's sad. And, you know, I think I look to the leadership on this call and the leadership on the ground outside of elected office as the people that are going to be innovative, the people that are already coming up with ingenuity, and that have been making things work when there was nothing to be solved. Yeah.
I think it's impossible not to pay attention to the fact that these disparities are happening in certain neighborhoods, and that these protests are happening, a lot of them in wealthier, less diverse communities. That's definitely, I think, from what we've seen, an intentional choice, because it's true, like you said, the next day, you know, the streets are clean, and everything is tidied up, whereas a lot of people have expressed having to go back home to a lot of these disparities. They don't get to wake up to a clean and tidy environment in a different sense, in what they struggle with every single day. So yeah, I agree. It's you can't separate the two issues. And it's been interesting to hear all of you speak about how we can address that in a budget, and definitely curious to learn more.
Diego, is there something that you'd like to add?
Yeah, you know, the comments, Sonia's comments, for us at our agency really resonate with the fact that the context within which we do our work, right? We engage in, for example, our foreclosure prevention work in the shadow of, in the context of a history of redlining against, you know, communities of color. We engage in our employment rights work in the context of the laws being written and being carried out on the bodies of communities of color, right? The fact that the immigration code has, throughout our history, has been rewritten to allow certain individuals in, and then, you know, once we are done building our nation on their backs, changing that code to say, no, thank you. And so we are always doing our best to take a step back, to look at that context and to reaffirm the nature of our work and make sure that we understand the role of race, the role of gender, other intersectionalities as we carry out our work in collaboration with the community.
Great. David, do you have a final thought on this? Because we're going to start wrapping up. But
Okay, great. Thank you. Yeah, look, SEIU, 3 years ago, I think it was, we took on the issue of race, not only within our organization, but outside of our organization as well. And we made a commitment to being an anti-racist organization in how we are in our language, in how we present ourselves, you know, holding ourselves accountable to that standard and driving that standard externally to as well. What we're seeing right now is basically people responding not just to the death of George Floyd, but also to the more than 100,000 people who have died disproportionately, people of color. And I like to add this question about children in cages. That, you know, historically, the police force has been used the use of force has been used in order to continue to perpetuate the conditions of white supremacy in this country. If we look at during the civil rights movement, if we look at during Reconstruction, there's always been an element of use of force in order to suppress and oppress Black people in this country, by extension, people of color. And right now, and you know, I listened to what Vice President Biden said this morning, who's been the only, you know, it's unfortunate what we saw last night of a president who chose to use props and chose to use language of, in my opinion, fascist language in a democracy that we are built on a constitution, to then juxtapose that against what Biden said, Vice President Biden said this morning, and the acknowledgement that there is a true divide in this country, and that divide historically has been within people of color, within the Black community. And so, you know, we have to reckon with the sin, the original sin of slavery, how that has impacted and continues to perpetuate a mentality of white supremacy that results in the death of George Floyd with the police officer on his neck for 9 minutes. And that is the moment we're in. And you know, right after this panel discussion, I'm going to downtown and I'm going to go add my voice to that anger. And you know, and we do our work as an organization through nonviolent means, but you know, I remind us that, you know, Martin Luther King said riots are the language of the unheard, you know, and you know, not to condone it, but there is a visceral anger out there, and it hurts to know that there are people suffering in this country right now, and it's hurtful. And to know that my members have to make a choice to go out and have to work in violence, to have to work in fear of catching a virus because they have no other means to be able to support their families because a system that was developed, that's created not in their image and not in their interest. And so I think we just have to come together and demand change. This is the moment we have to do that. In every crisis is opportunity, and this is our opportunity. If we look back on the Great Depression, fundamental change came out of that. And there's also been regressive points in crisis. We cannot regress. We need to move forward. We need to come together. We need to push our voices forward. And we need to win in November. We have no other option. And so I stand in solidarity with all my fellow panelists, and I stand in solidarity with Black Lives Matter, and I stand in solidarity with all the dreamers, and I stand in solidarity with all people who right now who are feeling the 40 million people who are unemployed. And that's where my heart is, and that's where our organization is going to continue to be. So, I thank you for giving us this time to be able to express our opinions, our views, and what people don't often talk about. And I think this was a good hour, and I really appreciate it.
David, thank you so much. What a call to action. We can't afford to lose the opportunity created by crisis. And thank you so much, David. What a great call to action. I'm going to ask, we're wrapping up now. So Diego, if you can share some final thoughts. Alejandra, then if you could kind of close us out since you started up, and would love to hear your reflections. And then Sonia will we'll take it from there. But again, David, I'm really moved by the work, and you reminded us how important it is to center workers in these conversations, that even systems, you reminded us of the Great Depression, and a lot of us aren't aware of the fact that even the New Deal was implemented in a racist way where Black workers were excluded from the benefits of Social Security for decades. We can't forget that even these great social reforms were actually designed to exclude Black people and people of color. So Diego, your last comments?
Yes, thank you again for the privilege of being here. And I want to acknowledge my own privilege is being an immigrant whose parents worked very, very hard and allowed me to have this position where I get to work from home. It's not lost on me, and what it means to be at the head of this organization now, an organization that will now and forever be at service to the community. And I want people who are out there to understand that there are, we talked about mental health needs, we talked about healthcare workers, and the fact that for those of you out there who have questions about what your rights are as workers, as tenants, that BATSETIC and many other organizations like our colleagues at Public Counsel, Legal Aid Foundation of Los Angeles, Neighborhood Legal Services, we are available and we are here to help. And whether it is just needing to sit down and understand what your rights are, to actually having an attorney be there with you as your voice in front of an administrative judge, a court officer, we can help, and we need to be together with colleagues like David and the work that he is doing, philanthropy, and all others to implement these reforms that will lead to systemic change. That is critical. That is what we have been saying. The systemic change is necessary. Let's embed that now before we lose this opportunity, as you said earlier.
Yeah, and thank you again as well for inviting me and also allowing me this hour. I'm so glad to learn from all of you and also kind of reflect on my own experiences. I know journalists are classified as essential workers, it doesn't feel the same in the sense that we're talking about other essential workers who work in service jobs. I still also acknowledge a lot of the privilege I have in being able to work from home a lot of the times, though not always. And it's been good to doing this work. It's been good for me also as the daughter of immigrants. Both my parents, my entire family are all essential workers. So it kind of allows me a moment to stop and kind of reflect and think about that. And these stories that I hear in my everyday work help me as much as I hope they help others as well. And I think if we're not documenting them, if we could document, the data, we could document the facts, which is of course necessary, but also if we're not documenting the personal stories and personal struggles of people, I think it can be lost on people, or I just think it allows for an opportunity to empathize and really feel that these issues are real. So I know, at least personally, I'll continue to work on telling those stories, even as I go out to these protests probably later today and tomorrow in the coming weeks. And yeah, thank you again all for having me.
Thank you, Alejandra. Sonia.
Awesome. To the panelists, thank you for your leadership, for your collegiality, and for your voice that was righteous during a moment when there is massive distrust, fear, and uncertainty. For those that are in the audience, there are things that we can do, and it starts with something simple as saying no, saying ya basta, to thinking through about how we need change at all levels. There is so much stuff that is intentional occurring right now from our leadership, whether it is intentional silence or it's intentional exclusion. And frankly, that is not going to save lives, and it's not going to rebuild the economy. Any sort of change is going to have to be predicated on the needs and the opportunity extended to workers and working families. And that starts with Black workers, Latino workers, Indigenous workers, Asian American, Pacific Islander workers. And their exclusion is complicit in the decisions happening not just in Washington, D.C., but in Sacramento, in City Hall, etc. And so it's really incumbent upon us, do we want to live in the 21st century that is about innovation, which means equity, or do we want to go back to what we saw yesterday and unfortunately what we see every day when a person of color, a Black woman, a Black man is killed at the hands of law enforcement? These are all budget decisions, and this is our money. And so I'm excited that we're amplifying the needs of what I think is ostensibly opportunity, which is the voices of workers and leaders like you. So look forward to thinking through how we can think about collective action, and to all those that are working, all those that are staying safe, all those that are on the streets, thank you. Appreciate everybody. Stay safe.
Thank you.
Thank you. Good night.